We already know that the profession, the institutions we work in, the healthcare system as a whole affect nurses' well-being. And adding in the experiences of racism and discrimination only amplify those issues that we're already aware of: burnout, fatigue, exhaustion, and the like. Whether you're a white nurse or a nurse of color, we all have to go through this self-awareness journey to better understand ourselves, to move this work forward, and help us to better understand other people. Racism not only is a public health crisis, but it has no place in a profession that is supposed to be the most trusted, that are supposed to be stewards of social justice and health equity.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS. And today we are joined by Marcus Henderson, lecturer from the University of Pennsylvania's Department of Family and Community Health, Director at Large on the American Nurses Association Board of Directors, and member of the National Commission to Address Racism in Nursing, to discuss racism in nursing and how to eradicate inequity in the profession. Marcus presented on this topic during the keynote at this year's ONS Bridge virtual conference in September. You can also earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thank you for joining me today, Marcus.
Thank you, Stephanie. It's a pleasure to be here.
I'm looking forward to our talk today. I really enjoyed your presentation at ONS Bridge, and I'm excited that we get to talk a little bit more. So to start us off, can you share your experience with racism in the nursing profession?
Thank you, Stephanie. I've been thinking a lot about this recently, ever since the launch of the National Commission to Address Racism in Nursing, and just given a lot of the pivotal events that have been happening throughout our country over the last 2 years: the COVID-19 pandemic, the murder of George Floyd, and so many others. And my story obviously begins when I was born. I was raised by a white mother and a black father, but for much of my life, I've always identified as being biracial, but I struggled with that identity because of the community that I lived in and the beliefs that my white family held about me and the black community. And it wasn't until recently, in June of 2020, where I had a patient's mother blatantly express her prejudicial and racist thoughts about the people that I worked with, about the black staff members and the black children that I cared for. And it was really that pivotal moment for me where I said to myself that this woman was comfortable enough to look at me, assume that because I appear white, that I am white, that she felt safe enough to express her racist and prejudicial ideas about the people that worked at my facility and how her son in some way could be harmed or wasn't safe because there were black staff members or other black children on the unit that her child was being cared for on. And I remember looking at that mother and just saying, that your son's safe. He's engaging with the other children on the unit. He's having appropriate, positive, healthy interpersonal relationships with the children and staff. There's nothing that she needed to worry about. I never once fed into the false belief or this idea that her son was unsafe because he was surrounded by black people. I never fed into that once. But from that experience, it really ignited this continuous journey of self-reflection in how I can be the best nurse that I can be using an anti-racist lens. And I quickly began reading a lot, listening to a lot of podcasts, and really taking a deep dive into better understand my own lived experience and my own story, how I may or may not have contributed to the perpetuation of racist beliefs and ideas by my own actions. And then it made me think about all of my colleagues that I've worked with, that I was educated with, and just the stories that they've shared with me that now obviously are linked to racism, but at the time I didn't think of it as such. For example, the tokenism that my colleague experienced, to be that singular voice for underrepresented communities or communities of color, being the only diverse person in a cohort, in a room, on a committee to highlight, and you can't see my air quotes, but to highlight the air quote diversity that they have, even though it was only one person. Countless colleagues being passed over for opportunities despite their credentials and experience compared to their white counterparts. And students of color who have their own social needs, financial, social support needs, academic needs, and being told that they won't succeed and that they weren't enough to get through their educational program because nursing is built upon this ideology centered around whiteness and that of the middle class woman being the ideal nurse. So a lot of the programs and support and the way that our schools of nursing and nursing practices design is to benefit the majority. And we see countless time after time after time where nurses of color and from other underrepresented backgrounds are just looked over because of that majority view of white-centeredness.
Thank you. I appreciate your vulnerability and your candidness with talking about the experience that you've had and also talking to us about your recognizing that and having to, like you said, take a deep dive and kind of look into things a little bit more. I think that's what this discussion and having this topic kind of be brought more to the forefront for all of us to start doing and to really start taking a look at that, everywhere we work as well as internally, just how we turn that inward and look to ourselves and so that we can understand that more and start to see how we can make an impact.
Mm-hmm. Definitely. And it's one of those things, at least for me, it's that I've benefited from white privilege throughout my life because I've had the benefit of being able to be passed over. So where people don't see me as black, so I'm therefore accepted by the community or group or wherever I was because I was outward appearing as white. And that was probably one of the pivotal learning points for me of recognizing how I benefited from that privilege and getting to the vulnerable space where I recognize that and then think back on all the instances where I caused harm or potentially caused harm. And then trying to think about how I have this privilege that others don't. I'm biracial and I have this privilege of being outward appearing as white. So how do I ensure in the spaces and places that I live and I operate and I work and I advocate, how do I ensure that those voices who have been marginalized, those voices who have been silenced are heard, are brought to the table, and are valued? And that's something that I'm still constantly learning about. I'm no expert in this anti-racism journey for sure, but I'm comfortable saying when I don't know something. I'm comfortable saying when I need help to further understand something. And I'm comfortable when someone challenges me to tell me that I've said or done something wrong. I'm comfortable with being uncomfortable and having that difficult conversation because I want to learn more and I want to push my students and my colleagues to learn more. But I think a lot of the time we're afraid to even initiate that conversation. And sometimes I'm probably not the perfect one to start the conversation. And I've experienced that many times, or not recognizing what it looks like when I'm the one holding the microphone in the room talking about a topic such as this. But I'm reminded by my own lived experience that I've sheltered and that I've bottled up because of what people used to say about me, that I wasn't black enough, that you can't speak to these issues because you don't get it because you're not Black enough. Or the reverse was, using my physical features or other things to confirm my Blackness or confirm my Black identity. So I think that self-awareness piece that we'll probably talk about later in the conversation is crucial, and it's an ever-evolving process that we all must go through. Whether you're a white nurse or a nurse of color, we all have to go through this self-awareness journey to better understand ourselves, to move this work forward, and help us to better understand other people.
Yes, and that's so good. All of that information that you just gave, I mean, that's powerful, and you do have such a unique perspective, and I appreciate you being open and talking about that. And like you said, it's being okay with being uncomfortable. And I don't know that, everybody is. I know that everybody is not that way. And it's, that learning that we have to do for ourselves. So, in talking about this, and something that you did talk about in your keynote presentation was just kind of that historical understanding and looking at the qualitative data that there is about racism in nursing. So, can you talk about how some of those different types of racism showed up in nursing?
Yes, certainly. And you'll recall from my presentation that I kind of broke it up into three buckets. And those buckets were structural racism, or kind of the processes of which that racism is embedded in our laws, policies, practices, institutions, etc. Cultural racism, which is the ideology of inferiority in the values, language, imagery, symbols, and unstated assumptions of the larger society. And then discrimination, which occurs when people or institutions are treated differently, with or without intent. And when we think about in nursing, for me, I think it really starts at this cultural racism piece. Dr. David Williams talks about how this cultural racism piece leads to people internalizing negative stereotypes about individuals, about race, and then those internalized stereotypes then lead people to make decisions, whether that's structural level decisions that drive inequity, that drive racism, or individual level decisions of how I decide how to interact or engage with someone of a different racial or ethnic minority background. So when I think about cultural racism, I think back to Florence Nightingale. And a lot of people don't like to talk about that. But Florence Nightingale's vision for nursing was that of a profession of middle-class white women. So when we have that ideology that this profession should look like this, we don't begin to see, examples or photos of nurses of color and their contributions to the profession. And we're seeing that now. There's a whole campaign called Nurses You Should Know, where their goal is to highlight the contributions of nurses of color in the profession. So back to that cultural piece. So when we're only seeing images and symbols and have all of these different values of what nursing should be, rooted in Nightingale's vision, rooted in colonialism, then that's what we believe nurses are and should be. And that view of what nursing should have been and turned into being led to those structural decisions about who was admitted to nursing schools, who staffed certain types of units, their decisions about who gets the funding to do nursing research, eligibility criteria. So when we think about that ideology of what nursing should have been and ultimately turned out being, that's what has driven the structural racism that we see in the profession. When we're talking about the policies and practices of schools of nursing, nursing organizations, or institutions that hire nurses, we're talking about the criteria at which they establish who can be educated, who can be employed, who gets promoted. All of these things are rooted in that ideology of what nursing should be and should look like that has led the profession to establish these rules that promoted whiteness and did not acknowledge the contributions of Black nurses. And I think if we think historically, the National Association of Colored Graduate Nurses was founded in 1908 for that very purpose, that Black nurses were not getting just equitable treatment in the profession. And that organization's goal was to fight for equality, to fight for the advancement of Black nurses. And they did just that. They fought to integrate the Army and Navy Nurse Corps. They fought to gain greater awareness and promote the leadership of Black nurses within the American Nurses Association and other national and state nurses associations. They fought for, there was a time where certain state nurses associations didn't admit Black nurses as members, and the National Association of Colored Graduate Nurses fought to change those rules. And ultimately, we see in 1948 when the ANA changed their bylaws to allow individual membership. So Black nurses that were barred or denied membership from their state could still join the national organization. But it wasn't until 1962 when, no matter what state you lived in, a Black nurse could join and become a member. And again, it's rooted in that ideology of what the profession should have been or what it was viewed as, leading to those policies that have disadvantaged, marginalized. My examples are mostly Black nurses, but certainly this is true for other nurses of color. But I think much of our history relates directly to the experience of Black nurses.
It's so interesting when you do start looking back and looking at that as a historical perspective. And, like you were saying, whether it was schools of nursing or state nursing associations, and then up to the ANA, and how the Black nurses were either not offered those memberships, or things were how that change happened, and or how the schools of nursing also changed in admissions and things like that. So it's just a very interesting historical perspective to look at.
And again, it's not perfect. I mean, we still have less than 20%, or might be at just 20% of the nursing workforce being from racial and ethnically diverse backgrounds. So, yes, throughout history, we see critical points of advancement toward equity for Black nurses and other nurses from other marginalized backgrounds, but we still see these problems persist today. And again, we can sit here and blame nursing, but we also have to remember that we as a profession of nursing lie within a greater society. So when I talked about cultural racism earlier, about that ideology of inferiority that's instilled in the values, the language, the imagery that we see, that's how nursing evolved. Individuals who in their communities were raised around or seen or what have you, and they held those negative stereotypes and those false beliefs and those racist ideas to be true, and then they entered the profession and then perpetuated those in their practice and their leadership roles, whether explicitly or implicitly. So we can talk a lot about how nursing has been complicit. But again, it gets back to that structural piece of there's also a bigger beast that we have to tackle here. And we have to address it in nursing because that's our own house. But we also have to think outwardly of, if we're going to address it in our own house, that also requires us to address it in our communities and our larger society. And we need to think critically about how we're going to do that as well. Because people go home. People live in a community where they're still going to believe certain things or experience racism. So it is a much larger beast, and we can't forget that.
Exactly. So you've mentioned just in your comments challenges, and what kind of professional challenges there have been. So how can a hostile or racist work environment create those challenges and affect the well-being of nurses in their workplace? Can you talk about that a little bit?
Certainly. I mean, we know that racism harms. We know that experiencing racism or discrimination impacts health. There's evidence to say that individuals who experience discrimination have increased risk for poor health, mental health, sleep disturbances, obesity, hypertension, cardiovascular disease, and many other things. So, while there might not be a study explicitly on a nursing population of the experience of racism impacting their well-being, we know that it impacts from the studies that we have conducted in our larger society. And again, I talked about those professional challenges, not being promoted, being treated differently, having your competency called into question to whether or not you actually could be a nurse. So many stories of where nurses of color are mistaken for other professionals within the field because there's no way that they could be a nurse or even a physician. I mean, just imagine being in a place where you're excluded or marginalized, where you're told your voice isn't valued, where you're told that you can't contribute. I mean, just imagine how that would impact you psychologically. So I think, in nursing, we're always talking about empathy and being empathetic to others, putting ourselves in their shoes, so to speak. So if we think about it in that perspective, if we think about being excluded, not being valued, having your voice silenced, being left out of conversations, being given a higher workload or burden, to have to prove yourself constantly. Imagine the psychological impact that would take on somebody. I went into this profession to help others, and hopefully your colleagues went into the profession to help others, but yet I'm living within and working within a society and a healthcare system that thinks I'm not competent and thinks that I shouldn't be here. So just imagine the toll that would take on somebody's well-being. And we don't protect one another. We spoke earlier about kind of how a lot of people don't feel comfortable talking about these topics. Or, we often hear, well, I'm not racist. Nursing's the most trusted profession, so how can nursing be racist? And Ibram Kendi talks about how saying you're not racist means that you're not actively racist, but you're also not actively against racism. So you take this neutral stance of, in this space and place, I'm not racist, but I'm not going to advocate or address the issues of racism that surround me. That's really, I think, where nursing has been. We have overlooked or chose to ignore the impact that racism has in society because we don't teach about it in nursing school. We don't teach about how racism impacts health. So because we don't teach about how racism impacts health, how are we going to teach about or have a discussion about how racism impacts our own profession and our own colleagues? One of the lessons that we hear a lot during the COVID-19 pandemic is recognizing everybody's common humanity. And we still exist in a society and within a profession that we don't see each other as human beings. And that's the problem. So when we don't see each other as human beings, we're not actively concerned about how other people feel or how our actions impact other people directly or indirectly. And going back to that psychological impact, then we're having people leave the profession. We're having people leave institutions to go to other institutions. And that means those professional challenges and those hostile or racist work environments are never changed because the people who we want there, the people who will help us advocate for change, the people who have the lived experience, who will give us the best insight on how to instill this change and eliminate racism in the workplace and in our society, they leave because of the challenges and barriers that they face every day. So how are we supposed to fix this problem if we can't even treat each other as human beings?
I think, Marcus, you just have brought up a lot of really good points and a lot of the things that we all do need to take a look at and, take a look at, like you said, culturally, as well as, personally, and, just what that looks like for wherever we are in our employment, however that looks, but just being able to take the time to look around and see where that impact is. And I think it's important that, folks learn to not be afraid to ask the questions, I guess is the important thing, and be willing to hear what the answers are and listen to what they are. We've talked a lot about, those challenges and, where racism is prevalent, but let's talk now about who and what people are doing to help eradicate racism in nursing. Can you share some examples of some institutions or programs that are doing that?
Yes, certainly. A couple of different things come to mind. One being, and I talked about this in my Bridge keynote, but the National Commission hosted listening sessions to really hear contemporary examples about how racism is operating and to the extent that it harms and impacts nurses of color in the profession. You're beginning to see many organizations across the country kind of begin with that approach of listening to the stories of nurses and how this is existing today. And I think that's one great example of programs that institutions can utilize to get a better handle on to the extent of which racism and discrimination are operating within their own institutions by hearing directly from the nurses that work there. But the important piece to that is ensuring safety, not only that it's a psychologically safe place for the person to share their story, but also that when they're expressing these vulnerabilities of how they've been treated in the institution or in their community, that they're not retaliated against. So it's ensuring those mechanisms, not only of safety for the person that's being vulnerable, sharing their story, but safety to the extent of which that they're calling out an institution for their racist behaviors or how they've disadvantaged someone. And it's not calling out individuals. Whenever racism's called out, we take it personally and we get defensive, but you're calling out a system. You're not directly calling out an individual per se directly. Sure, someone might be sharing their story in that listening session of an example of a person that was racist, but recognizing that's baked into the larger context of a system, I think is important. Another example is at the Johns Hopkins School of Nursing. They've established a curriculum committee that is going through all of their courses to document the extent of which course content, teaching strategies, simulation materials, you name it, everything that's baked into nursing education at this institution is either directly or indirectly perpetuating racism, inequity, or what have you in the way that we teach certain content. And we know that that happens often. I mean, in greater society, ONS has a publishing arm, and there's a lot of talk in the scholarship space about how we write about racism, how we research about racism, or really how we write about race, how we research and include race in our studies. And I think that's a really important step, is kind of taking that examination of the extent of which these issues are prevalent in the way that we teach, because that's impacting the next generation. Other examples, I would say that there really isn't a specific organization for this example, but there are so many organizations that either had diversity, equity, and inclusion committees or are now starting them. But I think the difference is before, in my opinion, those committees were established because you had to have them. We had to say we were talking about diversity and that it was an important issue. But really, organizations are now, in my opinion, taking action. Now, there's a lot of, there's certainly going to be a lot of opinion on what those actions are and how they're being done. But I definitely think there's a greater sense of action to address these issues within the nursing profession. I know the ANA California has recently developed a survey and a tool to measure the extent of which racism exists in nursing in California. So I think we're going to see a lot more examples of programs and tools and a variety of things that professional organizations, the employers, or what have you, are going to be implementing to address racism within their communities.
Those were some great examples of programs and institutions that are actively doing things to address racism in nursing. But now let's talk to our listeners. As a nurse in their institution, in their hospital, or as a nurse leader, what can they do to help eliminate racism?
That's a great question. And I think the first piece, and what I've talked about before, is kind of sitting down and going through that self awareness and self reflective process of your own, whether that's by talking with trusted peers and colleagues or friends, reading, listening to podcasts, or wherever you get your information, but really sitting down and trying to figure out your space and place in everything that's going on. I think that self awareness and reflective process is extremely important, and feeling comfortable enough to have a conversation with that trusted person that you have to kind of explore these issues deeper. And that's really how it started for me. I shared in my story, about that experience with that patient's mother. And that happened the weekend after George Floyd was murdered. And I remember calling a trusted friend of mine to just have that conversation and say to her, I know I'm not going to say this right. I know I'm probably not going to describe this right, but I really need to talk to you about how I'm feeling, process what's going on. So it's really kind of trying to recognize your own biases, your own assumptions that you hold about people, recognizing to the extent at which they exist in your life. I mean, everybody's prejudice. Everybody holds these stereotypes. There's not one person in this world that doesn't have a stereotype about another group of people, whether that's by race, sexual orientation, disability status, what have you. But it's recognizing that this stereotype or this bias exists within you, and being consciously aware and actively aware of not allowing it to dictate the way that you make decisions or interact with others. And from that self-awareness piece, it's then calling it out when it happens, speaking up, using your voice and speaking out when you see instances of racism and discrimination. And for nurse leaders, it's when people call out these acts of racism, whether they're calling it out amongst peers, so peer-to-peer racism, nurse to nurse, or they're calling out when a patient might display racist actions towards an individual nurse. So it's not only calling it out, but ensuring as a nurse leader that there's mechanisms in place to protect the individual who's reporting, and that you are really embracing accountability, that something's been called out. I'm going to ensure that person, has the support and resources they need to get through this. But then we're also going to take action, and we're going to hold ourselves accountable. And part of that accountability piece is being transparent with your colleagues, being transparent with the nurses on a unit, that an incident has occurred. And this is what we are going to do as an institution to rectify that. I think a lot of the times these conversations happen behind closed doors. Something's reported, leadership makes a decision, then all of a sudden you hear about an action that's taken to rectify that. But that frontline staff or nurses or whomever aren't really aware of the process from incident to resolution. So it's really about being transparent of that in between, because 9 times out of 10, there's probably not a diverse leadership. So it's, how do we ensure that we have the right voices represented? Not asking the question, is everybody here at the table, but who is missing? Because it's easy to say yes to the first question, but when you ask whose voice isn't represented, who has been silenced, that's something you have to think a little bit more about. So that's an important piece of accountability as well. Who is on your team? What voices are missing? Who have been silenced, to ensure that the diverse perspective is present to help best address and develop solutions.
Those are just some really good suggestions. And I think that our listeners will definitely be wanting to take that back and start, looking at things through a different lens. So, Marcus, you have talked about some of the historical perspective of this, but can you kind of tell us a little bit more, or maybe even just remind us, what are some of the achievements throughout history that have advanced equity in nursing for the BIPOC healthcare professionals? And for our listeners, BIPOC is an abbreviation for Black, Indigenous, and People of Color.
Yes, thank you for that question. And, I'll cover some brief points quickly. And that is, I think, one of the major achievements, at least in recent history, is in 1908 when the National Association of Color Graduate Nurses was founded. And that organization was founded to address the discrimination that Black nurses were facing, to fight for equality, and to promote the professional growth and leadership development of Black nurses. And that organization did phenomenal work in advocating for the equality of Black nurses in the profession. This organization led critical work toward the integration of the Army and Navy Nurse Corps that was desegregated in 1945. They led the advocacy to ensure that Black nurses, regardless of what state you lived in, could still join your national organization, the ANA and the NLN, two of the most prominent national nursing organizations of the time. Some other examples are of the various ethnic minority nursing organizations that were founded largely beginning in the 1950s to continue that advocacy for historically marginalized groups in the profession and the healthcare of those communities at large. The National Black Nurses Association, National Association of Hispanic Nurses, the Philippine Nurses Association of America, and so many others. These organizations have been pivotal in advancing equity for nurses of color and for their professional growth and development in the profession. And we need to do a better job of lifting these organizations up and their role in continuing to address racism in the profession and to advance equity. These are just a few examples of some achievements throughout history, and there certainly is much more work to be done. But I think leaning on these historical examples, using our colleagues that are leaders in these organizations now, is pivotal to help us to continuing to advance equity and promote diversity and inclusion within the profession. These leaders not only have the lived experience, but they have the expertise, the knowledge, the education, the credentials to lead us in this effort and to lead us in this work. And we need to lean on them more. And the National Commission to Address Racism in Nursing is a great example of how we're partnering with all of these organizations across the country to truly transform nursing practice, nursing education, leadership, policy, to further advance equity and to really ground nursing in anti-racist practice.
Thank you for giving us that overview. I mentioned in our intro that you were a member of the National Commission to Address Racism. What are the commission's goals and what are they doing to meet those goals? Can you talk about that?
Yeah, thank you. And thank you for highlighting the National Commission to Address Racism in Nursing. The commission was convened and is being co-led by the National Black Nurses Association, the National Association of Hispanic Nurses, the National Coalition of Ethnic Minority Nursing Organizations, and the American Nurses Association. The goals of the commission really are threefold, and the goals are to engage in a national dialogue within the profession to own, amplify, understand, and change how racism negatively impacts our colleagues, patients, families, and communities. The second goal is to work toward developing strategies to actively address racism within the nursing profession across the spectrums of education, practice, policy, and research. And the final goal is to use the nursing scopes and standards of practice as the framework to create a roadmap for action. So that is the larger goal. It's how do we embed anti-racism actions and behaviors into our core standards of practice as a profession.
So, what does the future look like then, for the commission and for BIPOC nurses?
Yeah, so right now the commission is really laying the groundwork to gain a better understanding of the historical aspects of racism in nursing and document the contemporary aspects of racism in nursing. So I talked a lot about the listening sessions, and that's just one piece of how we're documenting the current existence of racism in nursing. But we're also conducting surveys and using other modalities to really capture that data and document that data. And that's the biggest piece. So, and through that process, we're engaging in that national conversation. So, from that information, the commission is, like I said, going to work toward really developing how we as a profession can develop anti racist practice and work environments. And it's really through those standards of practice, really through those behaviors that our hope and our North Star is that they would be embedded in nursing practice everywhere across all of those spectrums. So it's certainly in the beginning stages to really collect all of that information. But I think what we're hoping to do, the strategies that we're looking at developing, I mean, we've engaged a diverse group of organizations, nearly 20 professional nursing organizations, including the Oncology Nursing Society, to guide this work, to take this work back to their organization. So it's not just these four organizations that came together to lead this work and document it, but it's really engaging such a large group of stakeholders who on a national level we can change this conversation, not only through the work that we produce as a commission, but also by disseminating it out through the 20 organizations that are represented on the commission, all of the state nurses associations that are engaged in this work to some extent or another. And then we also have subject matter experts from practice, research, education, leadership, and policy, from organizations and institutions from across the country that are informing this work as well. So we've engaged a large group of individuals who are committed to addressing racism in the profession. Our hope for the future is that this truly is a pivotal moment of transformation for the profession. We recognize that it's not going to happen overnight, but we hope that people are seeing what we're trying to do, and we hope that it is inspiring others to go on this journey with us. We condemn any acts of racism that exist, any acts of exclusion, and we're really trying to be very upfront and clear about that. That racism not only is a public health crisis, but it has no place in a profession that is supposed to be the most trusted, that are supposed to be stewards of social justice and health equity. And we're really committed to creating that roadmap for the profession moving forward.
Well, Marcus, I just want to thank you so much for joining me today and for being vulnerable, for being very open and having this discussion to help, all of our listeners to take a look, at this issue and how we can all be involved in this. And to end our conversation, I have some quick fire questions I want to ask you just to kind of wrap us up. And the first one I have is, what are some common misconceptions about experiencing racism in nursing?
I think some common misconceptions are that it doesn't exist within nursing, or that nursing or nurses can't be racist because we are the most trusted profession because of our role in our communities. And that's not true. We are also people that live in communities that have been raised in certain communities. So we too share this blame. And I think that's a common misconception that, nursing, we are this giving profession. So how could we discriminate or treat each other differently? And I think that's an issue. It does exist, and we have to acknowledge that.
Okay, my next question. What's something about racism in nursing that's not often discussed, but you wish people knew more about?
Well, I already said that it exists in nursing, but I think the other piece is that historical context. A lot of people don't like to think about nursing history beyond Florence Nightingale. And there's a whole other view that we're missing out on. And I mentioned the Nurses You Should Know campaign that's really starting to lead that effort to recognize the contributions of historically marginalized communities in the nursing profession. So it's that there's historical context, that it's been plaguing our profession since our founding, and that's something that I wish people talked more about or understood.
What are some additional training and education that nurses need?
The first thing that comes to mind is asking the question of, how is racism operating here? So that question will help oncology nurses to better understand the existence of racism within the specialty, how it harms your peers and your colleagues in your specialty. So I think it really starts there. You can attend implicit bias trainings, you can attend, lectures or seminars or continuing education on the impact of racism on health, the extent of which it exists. But it's really taking that back. It's taking that information back to where you work and where you live and asking the question, how is racism operating here? What does it look like? Where is it, located? What policies and procedures, what cultural symbols or values or images do we use that reinforce this? So it's really taking that knowledge that you gain in those trainings and education into action in your local context.
Great. And my last question, what are some additional resources for patients or providers who want to learn more about racism in nursing?
I think a great resource that is continuously being built out is the National Commission to Address Racism in Nursing's website, that has documents showing some of our early work with the listening sessions, defining what racism looks like in nursing, and some other work that will be coming down the pike. So I think that is a great resource for individuals because it's constantly emerging and evolving, and we're updating that as frequently as possible.
And Marcus, do you have any final comments for us today?
We know that in nursing, the issues of burnout, exhaustion, fatigue are prevalent. And nursing is already an emotionally taxing and labor-intensive job, and it takes a toll on individuals. So add in being a nurse of color and experiencing racism, and the heightened experience of burnout, exhaustion, stress, and fatigue. That's compounded because nursing is already a stressful job. And now I'm working in a profession, in an institution, in a healthcare system that treats me differently, that views me differently, and that doesn't think I should be here. So when we talk about affecting nurse well-being, we already know that the profession, the institutions we work in, the healthcare system as a whole affect nurses' well-being. And adding in the experiences of racism and discrimination only amplify those issues that we're already aware of: burnout, fatigue, exhaustion, and the like.
Marcus, again, I just want to thank you for being with us today on this very timely and important topic. And I know that our listeners are really going to enjoy it and give them a lot to think about and that we can all work on. So thank you for joining me.
Thank you. Thank you for having me. It was a pleasure, and I'm so glad that the Oncology Nursing Society is taking action to have this conversation in your organization and within your specialty, because that's really how we're going to drive change, by constantly having difficult and courageous conversations to move our profession and our society forward.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.